So you can start
Good,
with the seminar. Okay.
good morning, ma'am,
Morning.
and all my fellow friends. Today's topic is about rickets, and I'll show you an image about rickets. This is how a normal ricket looks like. This is a bow-legged rickets and a knock-knee. It's also known as vargus and valgus. So my topic is rickets. So I'll start with introduction. Introduction. The name rickets is from the English ricken, which was at the turn and of the Industrial Revolution. The English disease resulting from vitamin D deficiency spread among city-dwelling poor children and become endemic in cities. Rickets is a condition that affects bone development in children. It causes the bones to become soft and weak, which can lead to bone deformities. Rickets in adult is known as osteomalacia or soft bones. Ricket is most common in children who are between 6 and 36 months old. Children are at the highest risk of rickets because they are still growing. In some cases, the condition is hereditary. What is rickets? Ricket is a skeletal disorder that caused by a lack of vitamin D, calcium, or phosphate. These nutrients are important for the development of strong, healthy bones. Ricket causes the bones to weaken and soften, stunt growth, and in severe cases, it causes skeletal deformities. Guillain-Barré, which is known as bone-legged, and badiness, bandy legs, and tabia vara. It is a varus deformities marked by outwards bowing at the knees, which means that the lower leg is angled inwards. Usually, both lower limbs, bones, femur, and tibia is involved. Genum valgum, knock-knee. Genum valgum, also commonly known as knock-knee. It is a condition in which the knee angle in and touch each other when the legs are stretching. This is because the knees are bent so far inward. Thank you, ma'am.
Okay. Thank you. Good. Who is the next participant?
Yes, ma'am, me.
Eva. Okay.
And yes, I'm going to be talking about the causes of rickets and how rickets is diagnosed and some of the symptoms. And the causes of rickets is mainly about due to lack of vitamin D and mainly occurs in children who doesn't get proper sunlight and food containing vitamin D. There are also problems with absorption in children. Some children are born or develop medical condition that affects the way their bodies absorb vitamin D. Some examples include celiac disease, inflammatory bowel disease, cystic fibrosis, and kidney problems. The symptoms of rickets might include pigeon chest, enlarged joints, protruding abdomen, bending of bones, pain or tenderness in the bones of the arm, legs, pelvis, or spine, stunted growth and short stature, bone fractures, muscle cramp. And there are also teeth deformities such as delayed tooth formation, holes in the enamel, abscesses, defective tooth structure, and increased number of cavities. And skeletal deformities including oddly shaped skull, bow legs that bow, bumps in the rib cage, a protruding breastbone, a curved spine, pelvic deformities, and lumpy joints. And the diagnosis of rickets. Rickets can be diagnosed by performing a physical examination, checking for tenderness or pain in the bones by lightly pressing on them. Doctors may also order certain tests to help make a ricket diagnosis, including blood tests to measure the level of calcium and phosphate in the blood, bone x-ray to check for bone deformities. In rare cases, a bone biopsy will be performed. This will involve the removal of a very small section of bones, which will be sent to a laboratory for analysis. And that is all, ma'am. Thank you.
Okay. Who is the other participant? Eva.
Bandrilin, ma'am.
Banrilin. Okay, Banrilin, you can start with your topic.
How can rickets be prevented? The best way to prevent rickets is to eat a diet that includes adequate amounts of calcium and phosphorus and vitamin D. People with kidney disorder should have their calcium and phosphorus level monitored or on a regular basis by their doctor. Rickets can also be prevented with moderate sun exposure. According to the National Health Service of England, you only need to expose your hand and face to sunlight a few times a week during the spring and summer months to prevent rickets. Most adults can get enough exposure to sunlight. It's important to note that too much sunlight can damage your skin, and sunscreen should be applied to prevent burns and skin damage. Sometimes to use of sunscreen can prevent your skin produce vitamin D can be beneficial to eat food that contain vitamin D or to take vitamin D. Supplement this preventive measure can significantly lower your risk and develop rickets. How it's ricket treated? Treatment for rickets focus on replace the missing vitamin or mineral in the body. This will eliminate most of the symptoms associated with rickets. Also encourage to consume foods product high with vitamin D, such as fish, liver, meat, and eggs. Calcium and vitamin D supplement can also be used to treat rickets. For hereditary ricket is combination of phosphate supplement of high level of the special form of vitamin D and required to treat the diseases. Finish, ma'am.
Okay. So you please ask questions starting from Kezia.
Okay, ma'am.
Kezia's
Ivan?
chart is very nice. What happened to Eva and Vanrilin? What happened to your charts? It's not even visible properly. Hmm. Even the writings are not that clear.
Kezia,
Yes, Hasina.
Kezia,
Yes, Hasina.
what is the difference between genus Varium and genus Velgum?
Genum varum is known as a bow-legged extra. It is a condition where the knees are bowing outwards, whereas genum vallum is known as knock-knee. It is a condition in which the knee angle in and touch each other when the legs straighten. Thank you, Hasina.
Welcome.
So, Iban,
Yes,
what is rickets in adult known as?
rickets in adult known as osteomalacia or soft bones.
Okay. Saka,
Yes,
rickets is common in children from which months?
um, from 6 and 36 months.
Okay, thank you. Nafi,
Yes.
Nafi, what causes rickets?
Lack of vitamin D, calcium or phosphate.
Okay, thank you. Ma'am, that's it, ma'am.
Okay, good. Next, Eva.
Okay, Hasina. Hasina. Hasina Johuri.
Yes.
Yes, can you tell me how rickets can be diagnosed?
Um,
ricket is diagnosed?
You answer her. She doesn't know the answer.
Okay, ma'am. Rickets can be diagnosed by performing a physical examination, by checking for tenderness or pain in the bones, by lightly pressing on them. And the next question, Kajal. Kajal,
Yes.
Kajal Kumari. Yes, can you tell me some of the conditions that children are born with that affect the problem with the body of absorption?
I don't know.
Okay. And the problems with absorption in children is due to diseases. Some examples include the celiac disease, inflammatory bowel disease, the cystic fibrosis, and some kidney problems. Okay, and Marbot, Marbot,
Ask somebody else.
Yes, ma'am. Yes.
Okay.
okay, Marbot, can you tell me 5 symptoms of rickets?
Symptoms of ricket. Mm,
Yes.
mm. And the bones are not straight.
What?
Uh, Symptoms of rickets. The bones even not straight.
Do you not know the answer?
No.
Okay, I'll tell you the symptoms of rickets are pigeon chest, enlarged bleeding of bones, fractures, and that is 5 only. Thank you. Ma'am, I'm
Okay.
done.
Finish. Banrilin,
Yes, ma'am.
ask questions.
Taba onion.
Ask something else. Please do it fast. I have class also. Okay, is it done?
Yes, ma'am.
Okay. Okay then. Anybody have seminar? Any other seminar today? If no, then at around 11, yes. Then at around 11 or else 11
Then can I start
like that.
now? Let me check ma.
Like me, you do it later, okay? Now I have class also for first semester. Okay. Yes.
Time. Which time?
After 11.
I'm tired.
After 11. Okay. For now I have class. You all can leave the meeting. Okay. Thank you.
Thank you, ma'am.
Okay.
Thank you, ma'am.
Okay.